Hi, I'm Natalia Cominali. I'm a health journalist and the founder of the Futuro da Saúde website. We are at Connect Day, an annual event promoted by Philips. This year, we are diving into the evolution of health, collaborative, smart, and connected. Over this series of episodes brought to you by Elsevier, we're going to talk about the power of partnerships and how strategies that link knowledge with informatics solutions can boost the healthcare system. To dive deeper into this, I am honored to have here with me Shiv Gopalkrishnan, Global Leader of EMR and Care Management of Philips. So welcome.
Thank you, Natalie. Thank you for having me.
And then I have Tim Morris. He's Vice President of Commercial for International Markets of Elsevier. So it's great to have you here.
It's a real pleasure.
So my first question for you both is, one of the themes of this event is about partnership and collaboration. Do you think that collaboration is important to healthcare? Why? I will start with you, Tim.
Thank you very much. Yes, collaboration is essential. No one company or no one group of people can deliver what we need within healthcare. We've got massive challenges across the globe. And great companies coming together can make a significant difference to patient outcomes. Working together in collaboration, we can bring clinical knowledge and information, evidence base, put that into the hands of doctors, but it needs to be in partnership with the electronic medical record provider because that's where the workflow is, and that's where doctors connect with that information. So it is impossible really to do this without true collaboration. And when collaboration works well, like it is with Philips here, it makes a big difference to the end user because systems are designed in the way they want to work.
I will ask you more about this later, but now I want to know your perspective. What's your view about collaboration in healthcare system?
Great. Well, listen, if you, as a patient, go into a health system to get care for yourself or your loved one, you're going to face or connect with multiple people, a front desk representative, a nurse, a clinician, a physician, a lab expert, so on and so forth. It requires collaboration within a health system to deliver care. Why should healthcare systems, there's technology, should be any different? There's expertise each one of these clinicians bring to the table. It's the same way how Philips, Elsevier, all these other companies can bring their expertise to the forefront. Ultimately, our responsibility is to deliver best care for the patient. We should really combine our efforts in doing so.
So talking about combined efforts, I want to know about the partnership. So can you provide us, Tim, background information about this partnership with Philips and what was in the genesis of this project?
Yes, the genesis of this was several years ago when we were meeting with customers here within Brazil who were also customers of Philips TASI. And what they were looking to do was to answer some of their questions at the point of care using clinical decision support. So we started to work very closely with Philips at the time to see how we could provide some of our content, particularly order sets and care plans, and place that inside the electronic medical record. And we spent a lot of time actually in partnership discussing how it was best to present that information to the end user. We wanted it to be in the Philips style. We wanted it to feel like it was the TASI workflow. We didn't want to take that away from the end user because we know it will be adopted if it's part of the natural workflow that they have already. We started to build this partnership through a technology partnership originally, and we've worked very closely with the customers at the same time. Unfortunately, COVID got in the way, and it slowed down a lot of the work that we were doing. And we spent a few years waiting to move forward so that we could get back with customers and really start to implement. But we've developed a technology partnership where we actually implement our content directly inside TASI. And we're now working in partnership to spread that through Brazil and then hopefully further afield as well.
And how long do you took to build this partnership? Thinking about how to do that and being intuitive, for the user.
I think when we look at the development of the actual workflow within this region, some of the elements of care planning and order sets that we were implementing was relatively new to the end user. So whilst electronic medical record vendors understood how to deliver some of these things, the customers didn't necessarily understand how that would work in their workflow. So we spent time trying to present what we've done in other regions to show customers how it might look, and then work with the technology teams to actually implement that. But the incredible difference is that now if we want to implement our care planning content, we can import that into TASI in about 8 minutes and have all of the content available, ready to roll. So we then just need to go with the customer and talk about training and change management, rather than the complexities of actually how do we get this content inside the system.
Very interesting. So my other question for you, Shiv, is about the health sector. And we know that it's a fragment sector. And I want to know your opinion about the whole of digital solutions, like Shiv, Tim was saying us about how this could change the way that we do healthcare here, not just in Brazil, in the world, like this kind of partnerships.
Yeah. No. Look, listen, I think the key here is bringing the experts to do the right things, right, to join forces with. If you look across the market, the way we drive efficiency for healthcare providers is through automation, and content is king in this case. Mm-hmm. Whether it is care pathway protocols, whether it is order sets, and Elsevier is a world-renowned expert in this. So why wouldn't we want to bring that in? But bringing it in context of a physician or a nurse's workflow is very important. It can't be a system that's sitting on the side and somebody has to alt-tab into a different application, log in. Very difficult, versus one click within the workflow for the patient and you get the efficiencies. How do we really combine the power of the expertise and the efficiency within the workflow? And that's the true partnership that we've been able to bring forth with this relationship.
And Tim, can you share with us outcomes? Give us specific examples?
Yeah, we are relatively early days with some of the customers here within Brazil market. But what we know is when you put in, for example, order sets content within inside an electronic medical record, we can have significant impact on standardization, reducing variation at the point of care. Now, we expect some variation. There's a natural variation because patients are all different. But actually what we want to see is standardized evidence-based care across the majority of patients so that we can reduce wastage within hospitals. We can actually improve the quality of care for patients and actually remove some of the overusage as well of some of the treatments. So order sets itself can actually reduce costs for hospitals, and it can standardize the care that's provided. When you look at value-based care across the globe, actually trying to improve the quality of care, the quality of the outcomes, but at a reduced cost as well, is really important. So that's one of the elements we're looking for as we deploy this within Brazil as well. But care planning as well is really important, because care planning is not just about documenting the plan of care for a patient. It's actually supporting the nurses. So when all the allied healthcare professionals as well. So when we implement care planning, it provides guidance on what are the potential problems for patients? What should I be considering? What assessment items should I be looking for? And then when I'm actually doing my interventions and I'm capturing that information, what is the educational aspects? Patient engagement is fundamental to actually patient outcomes. If patients are not engaged in their treatment or their future care, then we actually don't see the outcomes that we need. So actually at the point that we do care planning, we also define what educational information should be provided. And we work then with the allied healthcare workers to provide interdisciplinary care planning as well. So it's not just the nurse, it's the physio, the speech therapist, the dietitian, all under a single care plan. Now, we know that if you implement care planning, and we've seen this in results across North America where we've implemented care planning, we can see reductions in never events. So they might be things like patient falls, or it might be pressure sores. So these are the areas that are impacted directly when you implement evidence-based care planning at the point of care.
Talia, if I could just add to what Tim was saying, which is very fascinating indeed. I was just with the CEO of a large health system here in Brazil a few minutes ago. And one of the topics he was bringing up was how we can help him solve for value-based care. And look, value-based care is all about keeping the patient healthy and out of the hospital as best as he can. And having those type of care protocols and standards-based care techniques can really not only help keep the cost down, but also keep the patient healthy, ultimately improving the quality of life. So I think I'm totally on board with how Tim explained it. And that's what fascinates me about this opportunity ahead in this market.
And do you think that our sector is looking for strategies that bring this value-based healthcare?
100%. And I don't think Philips can do it all ourselves. That's why we need experts. You won't have a nurse operate on a patient. You need a surgeon to do so. It's just similar to like the same situation. We don't have the expertise to have, evidence-based, standardized protocols of care, but we do have the workflow technology. So how do we bring the best of both companies, ultimately solving a problem for our customers and delivering better care for the patients?
I would echo that absolutely. And when we look at value-based care, it's very hard to implement. And in fact, one of the challenges across the globe is there true evidence of value-based care being put in? There are for small populations, whether that's a healthcare group or whether it's for a small population within a region. But actually to make it work, you've got to engage with several groups of people along the way, which include the electronic medical record providers, the providers themselves, the payers in this process, but also the patients. And when you can bring these all together, then you can start to make an impact. So I expect it to really make a difference here in Brazil, but it takes time, and it's important to have the right facilities in place, the right technologies to support capturing that evidence as well, that it's made a difference.
And Tim, why it takes time?
Well, healthcare is very difficult to make rapid changes.
Yeah.
We know that. Even in research, it often takes 17 years from new research to actually turn into something that makes a difference within healthcare. COVID made a subtle change to that.
Yes, it's a little faster right now.
And it accelerated a lot of the technologies and the ways that we manage healthcare. Generative AI is going to make a difference as well, not only in the way that doctors and nurses interact with the information, but also in the way that we curate and create information as well. So previously, implementing something takes time, and also change management. Doctors don't like to be changed in the way that they work.
Mm-hmm.
And in many of the healthcare societies that we work within, people are paid for the services they provide. So if we start to talk about value-based care, actually what we're talking about is being paid for the outcomes in terms of the patient as achieved. And that is a fundamental change for physicians. It's a change for providers and for payers as well. So it will take time to implement some of these things. And technology and adoption of technology previously took a long time. We perhaps will see a change now post-COVID where technology and with generative AI things speed up.
And this kind of partnership that you have, it's like a first big step on this.
Yes. I truly believe that when companies work closely together, and we've been looking very closely at the partnership program that Philips put together at the APIs, the Smart on Fire, the opportunities to do greater integration in the future is going to make a big difference to the end user and to the patients ultimately as well. So it's an exciting development that we've seen within Philips these last few years.
Do you want to add?
Well, only thing I would add is the end users, the physicians and the clinicians, they're looking for transformation too. But I am on their side when we say they haven't been able to take on technology fast enough, because you can push rapid change in retail, travel, because getting something wrong is not as serious as in healthcare. If you get something wrong in healthcare, you could be seriously injuring a patient or impacting their lives. So the process of making sure those steps are followed correct before they put into action, I'm totally on board with that. So I do cut my clinician friends some slack here for technology adoption. Having said that, a partnership like this where we actually use a standard protocol based, and rather than just kludging something together, but a standard protocol based process, which are truly tried and tested, quality assured before we put it in front of clinicians, gives them a level of comfort and confidence, because they have to make sure that the end result is delivering better care, not taking a backward step.
So let's talk about the confidence and the data-driven decisions. So considering that science is evolving faster and health professionals need to be aware of all the changes that we are living right now, and how this impact the care they have with their patients, what are the importance of data-driven decisions?
Yeah, it's a great question, and it's something that everybody in healthcare has been talking about for a long time, because if as a physician you want to be up in front of the newest innovation of care and therapeutics, you're going to be reading too many papers a day, just enough to just keep up, not even delivering care. So how does a physician actually consume all this information, make sense out of it, and be able to implement that into a care delivery process? It's literally impossible. That's where technology comes into place. So what we're doing in this partnership as an example is, how do we build a common data set that can be constantly evolving, but doesn't have to be visible for the end user. It can just be a click of a button where a care order set was brought in, but that order set is constantly refreshed over time based on new guidance and evidence that we've been receiving. So it's almost the clinician has to really believe that the system is working for them, versus they have to be the slaves of the system in some ways and double check and cross check every single piece of information. So that's just one piece of example. I think those same kind of insights can be extended to multiple parts of the workflow in a care delivery process.
And I think as we progressed with healthcare, we've also seen our populations with comorbidities increasing. We've seen polypharmacy. So traditionally we've looked at drug-drug interactions, but now we need to look at drug-drug interactions, and it becomes more complex. When you look at a patient who has comorbidities, what is the correct pathway for that patient? So technology, traditionally in algorithms, in tree algorithms, is going to not be possible as we start to see these combination of comorbidities. So we need to look at new technologies that are going to allow us to determine how should I care for this patient in this way. And I think that's where there's some exciting new technologies that are going to really help. And we've been working with machine learning in terms of our corpus of knowledge that we have within all our journals, our books, our curated content. And we actually understand that the relationships between symptoms, disease, and treatments. But when it comes to putting that in front of a doctor, it's actually very difficult for them to say, how do I know this is the right information for this patient today? Is it the latest guidance? Do I have this drug available to me? So we need to work in collaboration with the electronic medical record to help surface that and make sure the clinicians are able to treat patients safely and effectively with the latest information. And as Shiv says, I mean, the knowledge that a doctor has to do, they literally have to read for hours a day just to maintain their knowledge in their own specialty, not in everybody else's specialties. Yeah. And as comorbidities occur, of course, they start to need to think about other people's specialties as well. How does that impact my patient today? So these are the challenges that we're facing. Technology will be able to help us solve some of these as we move forward.
It's interesting because here in Brazil, at least, we have a lot of doctors that are like overload with a lot of jobs. So it's good to make their lives easier, like to help their decisions, right?
Yeah, absolutely.
So the next question is about the process of implementation, Tim, about this partnership with Philips. How the implementation process been like? Were there any challenges to integrate the workflows? I know that you said a little bit of this in the beginning of our conversation, but after that, you said 8 minutes, you have to. Yeah,
that's right.
But right now, how it's working?
Well, I think when you look at a partnership like this, it's a relationship between two companies. It starts off with a basic understanding of what we're trying to do. But actually, when you get into the detail, you have to really work closely to understand what you're trying to achieve. And as, over time, that relationship improves and it makes life easier for the implementation. Now, COVID didn't help because there was a gap in terms of technology and time when we weren't working. But when we started to implement with our customers, Angelina Caron, we actually could start to see what the end user would experience. And we can remove some of the barriers for the implementation process. The one thing that we really want to achieve with Philips is to have something that is so easy to install. That's not the issue. We can then focus on change management, understanding what the difference this can make for patient outcomes. We don't have to spend time in terms of working with technology and implementation teams. So we're looking to streamline that. As I say, when we implement our care planning, 8 minutes to import all of the care plans in Portuguese, available to be used immediately. We can then focus on the people and how they're going to use that. And we've developed that over time. And in any relationship, it takes time. There are teething issues sometimes. And we need to challenge each other sometimes on what we're trying to do. But a good partnership, we've been able to develop that. And I really feel now that we're starting to see the fruits of that hard work as we go out to a wider market.
Great.
Do you want to add? No.
No, I think it was well said. Tim did a great job summarizing it. And I think that like any relationship, and we had to take our steps, we were learning along the way too. So I really appreciate the patience that the Elsevier team demonstrated in helping us, because this model is now something we are replicating with some of the other partners as well in other areas of expertise that we can also bring forward. So thank you, Tim.
Like a learning process.
Indeed.
To do this with others. Great.
Yep.
And another question I have, it's about the next step. So you have the implementation process and it's good, it's working. And now you have to do this inside the institutions, like in the hospitals, and to work with the culture, with doctors and multidisciplinary teams. What's the difficult to do that? How you are seeing this changing, like the people wanting this kind of solution?
It's very interesting because sometimes hospitals have been using a product for a long time, and therefore you're going in, you're adding content and slight changes to the way they work. They react differently to a hospital where you're implementing as a greenfield. So they're learning the whole product of Philips TASI plus the content. So we have to shape our training slightly different in those situations. And we have to work with change management as well. Don't forget, this is a digital journey for many of our hospitals. Many have been on paper for years. And actually moving on that digital journey means that they're implementing and taking away paper. We're not just implementing a paper replacement. We're offering a different way and a different workflow to enhance the quality of information capture, and the decision support is available. And that does require change management. As I say, some are more resistant than others. And we've seen success where we've implemented it in some hospitals because it's fresh and brand new. In others, you see there's a little bit of hesitancy because this is different. Now, where does this go? We hope that we're going to expand the number of customers here within Brazil, Latin America as well. We have the same content available in the Spanish, Latin American Spanish. And we hope then that we will move into a global position as well, and working with Philips in other regions where we've already met a meeting with potential customers as well.
Interesting, Shiv. I want to know your view about not just in this project, but the view of doctors and all the multidisciplinary teams to access new technology in their work.
Yeah, look, I think, like I said, I think there's the demand is there. Clinicians are burnt out, like you said, especially under the pandemic. So they're looking for tools that can improve their quality of life, while they're also improving the quality of life of the patient ultimately, because they care about it. And so there's a lot more openness to adopting new technology now, but still a level of caution, because the downside is pretty significant when it comes to patients' quality of patients' life, even in some cases. So I do think that is there. There's a lot more openness. And I think when we have two brands like Philips and Elsevier coming together, who have trusted brands and have built a deep level of expertise, not just within the market, but globally, that also helps, right? Where we can actually come in and show the evidence-based work that we've done, saying how we can really help solve their problems. So customers are absolutely looking at us as Philips, I know, where they say, we need X capability here, like for content, we need something for payments, we need something for payer connections, and we know you can't do it all. We trust this other partner. Can you make that part of the system which allows us to openly transmit data back and forth, but in a secure and safe way? And that's where this partner ecosystem work that we are launching within Philips comes in very handy, because then we can actually do it in a very controlled and tested way, keeping the trust of the customer intact. And a partner like Elsevier can really help bring their expertise to our capability set.
And Tim, I want to know about the plans of expansion. You said that you're thinking about to do this, but can you detail more?
Yes, so we already provide content in other regions like the Latin America region. We hope with customers, Philips TASI customers, to expand the footprint that we have within that region. And we're working very closely to make sure that we can maximize the customer experience in that way. But also in other regions, Middle East, we have a lot of business within the Middle East. Elsevier is in around 90 different countries in terms of our content currently. And we're looking to see how we can make it relevant to other markets where it's appropriate. But also that digital journey has been started and is looking to improve patient outcomes through digital technology and working with them. So we look at the global markets and we work with our partners to say, where are you seeing digital transformation and where can we work together to try and enhance the quality of the product that is actually delivered to the end user?
And what are the challenges to build a system tailored for Brazilian reality?
Yeah, and it's really important that we don't just look at translation when we actually deliver a product. Translation is just the starting point. There is the localization. So Elsevier actually has a content team in Brazil who are looking at the evidence globally. So we may create content in our North American region, which we're then able to use globally, but we will then do localization. Translate it, we then look at local guidelines, local drug information, and make it relevant. And in fact, when we're working with our customers in the AutoSets piece, they can even tailor it even lower to their own drug formulary, to their own services, so that it's relevant to them as well. That's really important. We use subject matter experts who are in the region, who understand the healthcare environment, what is available, and the direction of travel for healthcare as well. So we can apply evidence-based, but make it locally relevant. We've been doing that here in Brazil. We do that in Latin America. We do it in Europe, Middle East, and across Asia Pacific as well. But it's a very important part of the work we do.
Very interesting, very interesting. So my last question to both of you is how global partnerships like yours can boost emerging markets and how this impacts in the future of healthcare. So Shiv.
Look, I think this is a must-have now. I mean, this is no longer a nice-to-have anymore. I think the world of healthcare is looking for these type of engagement, these type of models going forward. There's a common term that's called co-opetition. Co-opetition, because in some cases you are competitors in some ways. In some markets you have to cooperate. And so how do we bring it together? And you will know that, and this is not the case with Elsevier, but in there are other cases where we may have a competitor who is also a partner in certain areas to help solve a problem. And I think that's the mindset we need to approach this whole space with. And to be able to deliver this change is very important. The other thing I will also mention is, we talk about if an innovation curve is a progressive step-by-step innovation. You don't necessarily have to follow the same curve for every market. In some cases, you can leapfrog from learning from. So what we're learning here, or what Elsevier has learned in Europe or North America, can be implemented here. They don't have to go through the same stages of evolution. And that's the beauty of this, is once you sort of tested it in one market, can we just leapfrog into an end state that can give a very differentiated experience for the clinician? So it's really the co-opetition and being able to scale and leapfrog. Those are the two things that customers are looking for to help scale this globally.
Shiv actually stole the words out of my mouth. No, I was thinking about the emerging markets. We know that the electronic medical record itself is not the be-all and end-all of making an impact in patients' lives. It's actually how you use these tools. And emerging markets have often had technology that looks after billing. So they know how to bill patients. They know how to reward doctors for the care they provide. But they're not very good at actually supporting the clinicians in their work or their workflow. Doesn't often support nurses. Now, what this leapfrog approach is, in the emerging markets, we don't have to go through that pain of learning how to make things better because it's already been made better within these systems. So we can actually take them to emerging markets and say, look, these are the best ways of improving your workflow, making your lives easier so you can focus on the patient care and improve quality of care for your patients overall. And the rest will take care of itself as we do that. So for us, these partnerships are really important, particularly in the emerging markets, to come in with something which is going to be relevant to them locally, is going to impact the way they work positively, and is not going to interrupt their daily lives in a negative way, which has been seen in other markets. So I think this is a great opportunity for the emerging markets.
Very interesting. Thank you. Thank you so much, Tim. Thank you so much, Shiv.
Thank you.
It was an honor to interview you both.
No, great to be here. Tim, it's great to be with you as well. And thank you again to you and your team for helping us partner together and solving this important problem for our customers.
Thank you. It's been a real pleasure being here.
Thank you.
All right. Thanks, Natalia.
Thank you. Thank you, everyone. Bye-bye.